So HBSC is now a network of over 50 countries in Europe and North America, and we work in collaboration with the European Office of the World Health Organization to really uncover new material, new ideas, investigate hypotheses and develop new theory.
I would like to acknowledge the significant contribution that the HBSC has made over the last 25 years to informing practice here in Ireland, and it's been an invaluable source to us in terms of trends in relation to behaviour and attitudes of young people and what affects their health and well-being.
This is great, 25 years, who knew it could go so fast, and all that data that we've been collecting from all over Europe and all over the world that informs us as to how to make interventions that are actually going to make a difference, because we're actually finding out what is actually happening in the context of young people's lives in the moment.
Now we are approaching our 25th birthday, and this is the 7th round HBSC is investigating the health of a national representative sample of young people, and I'm very happy to be a part of this achievement, because a lot of novel topics are introduced in HBSC Ireland this time. For instance, romantic attraction, sense of discrimination, sense of freedom, many mental health items, not just tapping into mental health issues, but also tapping into happiness and well-being and resilience.
I've been working on the study since 2005, so particularly interested in nutrition because I'm a public health nutritionist. More recently I've been working on youth participation, so getting young people involved in the study, so getting them to think about questions they want to include, helping us to interpret the findings, and also themselves actually presenting some of the findings for us, because this, I think, makes for better research.
We are a major part of the State of the Nation Child Report that is published in Ireland every 2 years. Our work has informed the Better Outcome, Better Future policy, and we're currently working with the WHO on the Child and Adolescent Health policy. So for me, one of the key elements, the most beautiful part of the HBSC is the commitment for children's life and improving children's life, as opposed to just making it stand out in a scientific world.
The HBSC has been around for 25 years now, but actually it's only in the recent years that school has got to know about these data. So they haven't been available for schools to work with. And this is something that's very important to the SHE network, that working together with the HBSC, we can hopefully make the schools aware of the existence of the data and also make schools use the data to develop health promoting practices.
We are really pleased to be able to collaborate with the WHO Regional Office for Europe on conducting the study together with the HBSC International Research Partners and the Department of Health in Ireland, and they all have made this possible over the last 25 years. I would also like to acknowledge the commitment and the hard work of my colleagues here in NUI Galway. In particular, Professor Saoirse McGowan, who was the principal investigator over a number of years, together with Drs. Michael Malco and Colette Kelly, and all the researchers and administrators who've been involved in the study over the last 25 years.
As a member of the team over the last 11 or 12 years, there have been many researchers who have been trained under the supervision of Professor Saoirse McGowan, Dr. Michael Malco and Dr. Colette Kelly. While the HBSC Ireland study is very important in generating data, it has also served a function teaching and fostering good research within Ireland.
Members of the Irish HBSC team have been quite central in the development of the international network, and I think it's important to acknowledge our contribution internationally as well as nationally to sustaining, developing and improving the study at an international level as well as at a national level, and I just want to acknowledge all of those who made that possible.